This week's lesson is about the muscular system, and the objectives for this system are identify 3 types of muscle tissue, compare the structure of a whole muscle and the structure of a single muscle fiber, describe the sliding filament mechanism of a muscle contraction, explain the role of calcium and adenosine triphosphate, or ATP, in muscle contraction, describe the relationship between skeletal muscles and nerves, including the motor unit and its relationship to recruitment and the events that occur at the neuromuscular junction. 3 types of muscles are skeletal muscle, smooth muscle, and cardiac muscle. And skeletal muscle cells are striated or striped and voluntary. They cause movement of the skeleton. So when we want to move a skeletal muscle, it's something that we think about before we do. On the other hand, smooth muscle cells, or visceral muscles, are non-striated and they're involuntary. So this is something we don't think about. We don't think about digestion. We don't think about breathing. And the contraction of smooth muscle enables the viscera or organs to perform their functions. Cardiac muscle is found only in the heart. It is also striated, but it is involuntary. And cardiac cells fit tightly together to conduct the heart's electrical signals. This slide illustrates the 3 types of muscles: skeletal muscle, smooth muscle, and cardiac muscle. And you see that the skeletal muscle is striated and it is voluntary. The smooth muscle is non-striated and involuntary. And you see where this would be found: organs or viscera, for instance, in the stomach. Something we don't think about digestion, which is always going on. It's an involuntary process. And then cardiac muscle, which is also striated, but it is involuntary and found only in the heart. Here we see layers of connective tissue. This is a cross-section of the triceps brachii, illustrating the layers of the fascia and the fascicles, or bundles of muscle cells. The fascia tapers into the tendon, which attaches the muscle to the bone. The fascia separates the muscle into compartments, and injury can cause compartment syndrome. Muscles form attachments to other structures in 3 ways. 1, the tendon attaches the muscle to the bone. 2, the muscle attaches directly, without a tendon, to a bone or to soft tissue. And 3, attached by a flat sheet-like fascia called an aponeurosis. Muscle fiber. The muscle fiber is a group of myofibrils surrounded by the sarcoplasmic reticulum, or SR. The cell membrane is the sarcolemma. The T-tubules are part of the sarcolemma and penetrate to the interior of the muscle. We'll be discussing that later, how the T-tubules transmit electrical signals to the interior of the muscle. Sarcomeres. A myofibril is a series of sarcomeres. A sarcomere extends from Z-line to Z-line, like you see in this illustration, and is composed of thick and thin filaments. These proteins are involved in the sliding filament mechanism, which is responsible for muscle contraction. The arrangement of the thick and thin filaments accounts for the striated pattern on skeletal and cardiac muscle. And you can notice here the difference in the length of the relaxed and contracted sarcomeres that you see. The mineral that's required for muscle contraction is calcium. Calcium is stored in the sarcoplasmic reticulum, or SR. When a muscle is called into action, SR releases calcium. The calcium floods the sarcomere and permits the interaction among actin, myosin, and ATP. This causes contraction. When a muscle relaxes, the calcium returns back to the sarcoplasmic reticulum. The interaction of the motor neuron and the muscle is described in terms of the motor unit and the neuromuscular junction. Skeletal muscle contraction only takes place when it is first stimulated by a nerve. Somatic motor nerves supply skeletal muscle. It emerges from the spinal cord and travels to the skeletal muscle. When an individual muscle cell contracts, it must contract maximally, but a whole muscle can vary its strength of contraction. Motor unit and recruitment are mechanisms that allow the force of contraction in the whole muscle to vary. And we'll talk about each concept more in upcoming slides. So a single muscle fiber has an all or nothing response, but a whole muscle can vary its force of contraction. Two characteristics of a whole muscle allow this: motor unit and recruitment. This slide depicts innervation of a skeletal muscle. So, a motor unit. A single motor unit nerve emerges from the spinal cord. It splits into branches. Each branch innervates a group of muscle cells. The motor unit is the nerve and the muscle fibers it innervates. Each whole muscle has many motor units. In recruitment, various numbers of motor units are activated. The more motor units that are active or recruited, the stronger the contraction. This slide depicts the neuromuscular junction. And as the term neuromuscular junction suggests, the neuromuscular junction is the space between the neuron and the muscle where innervation occurs. The action of acetylcholine as a neurotransmitter occurs here. Stored within its ending are vesicle, or membranous pouches, filled with a chemical substance called a neurotransmitter. Acetylcholine is released from the vesicles into the space between the neuron and the muscle membrane. The acetylcholine then unbinds the receptor site and is immediately destroyed by an enzyme that is found within the neuromuscular junction near the muscle membrane. Okay, what happens when there's impairment at the neuromuscular junction? Three things are mentioned here. The disease myasthenia gravis, a substance called curare, and neurotoxins, which include tetanus, Clostridium tetani, and botulism, Clostridium botulinum, which is also Botox. So the symptoms of myasthenia gravis are caused by damaged receptor sites on the muscle membrane. The receptor sites are altered so that they cannot effectively bind acetylcholine. Curare works by blocking the receptor sites on the muscle membrane. Because the receptors are occupied by the drug, the acetylcholine cannot bind with the receptor sites and muscle contraction is prevented. So you may have seen in a movie where they shot like poison darts at someone and they immediately dropped, and that would be caused by the paralysis from the curare, which is highly, highly toxic. The neuromuscular junction is not only a site for physiological activity, it's also a site for pharmaceutical activity and disease. You may want to refer to figure 9.4 in your text to see what happens if the neuromuscular junction is impaired. Let's look at the contractile force of a single muscle fiber. We have some words and definitions here. Twitch, which is a single muscle response in which a muscle contracts and then fully relaxes. Tetanus, and this is not like the disease tetanus, is a sustained muscle contraction caused by repeated stimulation, and tonus, which is a normal continuous state of partial muscle contraction, which we need in order to maintain our posture. So, in tonus, different groups of muscle fibers within a muscle take turns contracting while others are relaxing. Let's look at the energy source for muscle contraction. Creatine phosphatase is metabolized for a boost of energy during muscle contraction. The molecule acts as energy storage. Glycolysis is a normal process that occurs when oxygen is not available. You see that it's anaerobic metabolism. This process also causes lactic acid to build up in the muscles. And then aerobic metabolism occurs in the presence of oxygen. This process facilitates the breakdown of fats, glycogen, and glucose to produce more ATP. Okay, let's look at some muscle terms. And the first one is origin, and origin attaches to the more stationary bone, whereas the second one, insertion, refers to the more movable bone. Most movement is accomplished through the cooperation of groups of muscles. However, one chief muscle or prime mover is generally responsible for most of the movement. The next term up there is synergist. So what is a synergist? A synergist is a muscle that works with other muscles. Antagonists help return the body parts moved by synergists and prime movers back to their original positions. They oppose the action of another muscle. So in this figure, you see the biceps brachii contracts to flex the forearm. To extend the forearm, the triceps contracts where the biceps brachii relaxes. Let's look at muscle overuse and underuse terms. The first term listed is hypertrophy, which says that the definition is growth in response to overuse. So in some cases, hypertrophy could be desirable. If someone wanted to bulk up or body build, that's the desired outcome, hypertrophy. If they were working out at the gym all the time to bulk up their muscles, again, that would be desirable. However, with something like cardiac hypertrophy, it's undesirable, because what happens with cardiac hypertrophy is the heart increases in size because it's being chronically overworked, such as when a person is suffering from hypertension, high blood pressure. The next is atrophy or wasting, and there are several types of atrophy listed there. But factors that can contribute to atrophy, it comes from disuse and poor innervation. Typically, it's a use it or lose it type of thing. If you don't use your muscles, they will begin to atrophy. An example of a disuse atrophy is if, for instance, your arm was in a cast and you weren't able to use those muscles, then when that cast is removed, you'll see that that arm looks very kind of skinny and withered, and that is disuse atrophy. And then there's the case of denervation atrophy, and this is when the muscle is not the contact between the motor unit and the contraction. There's some type of a problem with that, and the muscle is not being innervated properly and used. Next, we'll look at how skeletal muscles are named. So terms such as vastus, maximus, and longus indicate size. And you see the example here for size is the gluteus maximus. Also, terms such as deltoid, latissimus, and trapezius indicate shape. So you know that the trapezius muscle is trapezoid shaped. Also, muscles can be named according to the number of sites to which they are anchored. And we see here direction of fibers on the slide. For instance, rectus abdominis. Rectus means straight, and the rectus abdominal muscles are straight. Also, the action that a muscle performs may be included in the name. And we see also location, for instance, the pectoralis. Number of origins, biceps, so the biceps has 2 origins, bi means 2. Origin and insertion, where does it originate and where does it insert? And you see the sternocleidomastoid. So that muscle goes from the sternum clear up to behind the ear, the mastoid area. And then muscle action, adductors bring the body part toward the midline, so that would be an action of the particular muscle. It would be referred to as an adductor. Many facial muscles are inserted in soft tissue rather than bone. And why that is because muscles inserted into soft tissue allow our facial expressions, such as smiling and frowning, etc. The frontalis raises the eyebrows and wrinkles the forehead. The orbicularis oculi encircles and closes the eye and assists in winking, blinking, and squinting. The levator palpebrae superioris lifts the eyelid. The orbicularis oris closes the mouth, helps form words, and purses the lips. The buccinator, or buccinator, you'll hear it both ways, flattens the cheek and helps position the food between the teeth. The zygomaticus is the smiling muscle. It extends from the corner to the cheek or zygomatic bone. The platysma allows you to pout and open your mouth wide. The chewing muscles are also called the muscles of mastication. Mastication means to chew. They all insert into the mandible. Both of the chewing muscles contract to close the jaw. They're considered the strongest muscles in the body. The muscles of the neck. The muscles of the neck are involved in the movement of the head and shoulders and participate in movements within the throat. The sternocleidomastoid contracts to cause flexion and rotation of the head. The scalene muscles act synergistically with the sternocleidomastoid. The trapezius helps with the extension and hyperextension of the head at the neck. Muscles of the trunk for breathing. The diaphragm is a dome-shaped muscle that separates the thoracic cavity from the abdominal cavity. The diaphragm is the chief muscle of inhalation, or the breathing in phase of respiration. Contraction and relaxation of the intercostal muscles and of the diaphragm change thoracic volume. Therefore, these muscles are primarily responsible for breathing or ventilation. Okay, we'll continue with muscles of the trunk, abdominal wall, and vertebral column. The muscles of the abdominal wall are layered to provide strength to contain, support, and protect the abdominal organs. They cause flexion and rotation of the vertebral column, and they compress the abdominal organs for various functions. The muscles that move the vertebral column attach to the vertebrae. These movements include flexion, extension, hyperextension, lateral flexion, and rotation. With aging, the erector spinae muscle loses contractile strength. So obviously that contributes to a stooped posture, which you may see in elderly individuals. The pelvic floor consists primarily of two flat muscle sheets and the attached fascia. These structures support the pelvic viscera and also play a role in expelling the contents of the urinary bladder and the rectum. Muscles of the shoulder, girdle, and arm. The trapezius shrugs the shoulders and rotates the pectoral girdle. The serratus anterior lowers the shoulders and allows the upper arm to move as if pushing a cart. The pectoralis major moves the upper arm across the front of the chest. The latissimus dorsi lowers the shoulders and brings the arm back behind the body. This is called the swimmer's muscle because the movement mimics that of freestyle swimming. The deltoid abducts the arm to a horizontal position. It also flexes, extends, and rotates the arm at the shoulder joint. It is a common site for an intramuscular injection. The teres major extends the arm at the shoulder joint. The rotator cuff muscles stabilize the joint capsule and rotate the arm at the shoulder joint. Rotator cuff injuries are common in athletes who use repetitive overhead motions. Muscles of the forearm. The triceps brachii supports the weight of the body during push-ups. Strengthening the triceps is very important for crutch walking. The biceps brachii act synergistically with the brachialis and the brachioradialis to flex the forearm. Pronator and supinator muscles have their origin on the humerus and insert on the radius or ulna. Muscles of the wrist, hand, and fingers. The flexor and extensor carpi groups and flexor and extensor digitorum groups are responsible for the movements of the hand and fingers. These muscles are located in the forearm. The tendons extend into the hand and fingers, acting as puppet strings. This arrangement means that the hands and fingers are small enough to be dexterous. In a relaxed state, the flexors of the fingers are stronger than the extensors. So what happens is someone that has been unconscious for a substantial period of time, their hand will form a contracture in the flexed position. And you may have seen this with patients. Carpal tunnel syndrome is something that is commonly heard of. And most of the tendons of the muscles that supply the hand pass through a narrow tunnel created by transversely oriented carpal ligaments and the carpal bones. So what causes carpal tunnel syndrome is repetitive motion of the hand and fingers, which can cause the tissues in the carpal tunnel to swell and become inflamed. And then this will put pressure on the median nerve, which causes tingling, weakness, and pain in the hand. Muscles of the thigh. Contractions of the muscles that move the thigh result in movements of the hip joint. The gluteal muscles extend, rotate, and abduct the thigh at the hip. The iliopsoas, the sartorius, and the pectineus flex the thigh at the hip. The adductor group muscles are the adductor longus, adductor brevis, and adductor magnus and gracilis. During horseback riding, these muscles allow a person to stay in the saddle. The quadriceps femoris and hamstrings move both the hip and the leg. Muscles of the leg and foot. The quadriceps femoris is made up of 4 smaller parts, or muscles. The rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. They all insert on the leg, extending the leg at the knee. The rectus femoris has its origin on both the hip and thigh, allowing flexion of the thigh and extension of the leg. The quadriceps femoris, as its name indicates, has 4 points of attachment. These muscles extend the leg at the knee. The sartorius allows the legs to rotate into position so that a person can sit cross-legged. The tibialis anterior causes dorsiflexion and inversion of the foot. The peroneus longus everts the foot, supports the arch, and assists in plantar flexion. Our last slide continues with muscles of the leg and foot. The hamstrings allow for leg flexion and thigh extension. The strong tendons of these muscles can be felt behind the knee. So you can feel back there, and you can put your fingers into what's called the popliteal fossa, and that's the area right behind your knee. The gastrocnemius and soleus form the calf of the leg. Both of these attach to the Achilles tendon, and contraction causes plantar flexion. The tibialis posterior also assists in plantar flexion and inverts the foot. Like the fingers, the toes are tugged on by tendons whose muscles, flexors and extensors, lie in the leg. If you look at figure 911 on page 166 in your text, you can see some muscles that have acquired rather interesting names based on movements that we are able to make. So this concludes the little lecturette on the muscular system. There's a lot of material to digest, so I hope that you will read your text, study it carefully, and I will speak to you soon.